guys, I am Annie, your friendly health coach. Welcome back to my platform. If this is your first time on my platform, please remember to like and share my page with someone. Today, I would like to share with you a bacterial infection that affects the lungs and can be fatal if left untreated. Do you know what this is? Well, I will tell you. It is called tuberculosis. It spreads through the air when infected people cough, spit, or sneeze. Although tuberculosis is preventable and curable, it can be fatal without treatment. There are different stages of tuberculosis, but that's not the focus today. My focus will be on the symptoms, causes, risk factors, and also how to prevent tuberculosis. I would like to share with you the most common symptoms of tuberculosis. Please listen carefully. If you or someone else has active tuberculosis, you will have a cough that lasts 3 weeks or even longer. You will have chest pain, you will be tired, and you also lose appetite. You will simply lose weight for no reason. You will have a fever, you will cough up blood or sputum. You will have chills or sweat night. Tuberculosis can even lead to stunted growth in children. Please know that the symptoms can occur differently in each person. The symptoms of tuberculosis may look like other lung diseases or medical problems. Talk to a doctor to get a diagnosis if you have symptoms that do not improve with a few days of rest. If you have pain, severe headaches, seizures, difficulty breathing, or confusion. If you cough up blood or have blood in your stool or urine, see a doctor immediately. Tuberculosis is spread through the air. The droplets containing the bacteria must be inhaled for the infection to spread from one person to another. So if you are close to someone with tuberculosis who coughs, sneezes, or even just talks near your face for an extended period of time, you are at risk of infection. Please note that hugging, kissing, or shaking hands with a person who has tuberculosis does not transmit the disease. Sharing clothes, bedding, or toilet seat also does not pass on the disease. But if you are in close quarters with someone who has tuberculosis for a long period of time, you can catch the disease. If you breathe in air that is saturated with the bacteria, do you know whether you are at greater risk of catching the disease or not? Anyone can get tuberculosis, but some people have a greater risk of getting it if they were born or have lived in an area where tuberculosis is more common, or if you spend a lot of time with someone who has active tuberculosis. For example, people who have lived in the same house, if you have a weakened immune system, for example, people with HIV, with a kidney transplant, or who are undergoing certain treatments such as chemotherapy. Children under the age of 5 are also at risk of contracting tuberculosis. If you have lived in crowded or unhealthy conditions such as homeless people. Also, if you work in environments where tuberculosis is more likely to spread, such as hospitals, schools, nursing homes, correctional facilities, or homeless shelters, you are at increased risk of contracting the disease. If you regularly smoke, drink alcohol, or take drugs, you are also at a risk of contracting tuberculosis. And if you have ever had tuberculosis and it was not treated properly, you are also at risk. To reduce your risk of tuberculosis, here are some steps you can take to help prevent tuberculosis infection and its spread. Number 1, get vaccinated. There is a vaccine that can protect against tuberculosis, especially in high-risk areas. Number 2, try to practice good hygiene. Cover your mouth and nose when you cough or sneeze, and encourage others to do the same. Wear a mask if you feel ill and have to go out in public. Number 3, minimize exposure to individuals with active tuberculosis, especially in enclosed or crowded spaces. Number 4, ensure good air circulation in living spaces to reduce the concentration of airborne TB bacteria. Number 5, get tested for tuberculosis infection. If you are at increased risk, for example, if you are HIV infected or you have contact with people in your household or workplace who have tuberculosis. Number 6, treat your underlying conditions such as diabetes and make sure you eat a balanced diet to support immune function. Number 7, see a doctor if you have symptoms such as persistent cough, fever, and unexplained weight loss, as early treatment of tuberculosis can help stop the spread of the disease and improve your chances of recovery. Please, if you have tuberculosis, make sure you practice good hygiene when you cough, including avoiding contact with other people and wearing a mask covering your mouth and nose when coughing or sneezing, and disposing of used tissues properly. It is no secret that the choices we make can have an impact on our health. So please take good care of yourself. I hope you put all my tips for preventing tuberculosis into practice. If you have any health concerns, please consult your doctor. If you have any questions or comments, please feel free to leave them below. Thank you and hey.